Hi, everyone. Thank you so much for joining us today for this brief opportunity of supportive training. These 20-minute speed sessions are designed to give you a quick dose of knowledge without the side of webinar burnout that we know so well. Before we get started, just a few quick housekeeping items. We do recommend that you view this presentation in full screen mode. That way you're able to see all of the content clearly that we are presenting. We will also be utilizing all of the features that Zoom has to offer. Please utilize the chat function for any of the activities that we point you to, or for getting any technical assistance. We'll also be using the raise hand function for some of our activities. And then if you have any questions on the content itself, please utilize the Q&A box. We will have some time at the end to address all questions. So again, use the chat for technical assistance and activities, Q&A for actual content related questions. And with that, I'm going to go ahead and hand it over to our presenter, Dr. Jennifer Salerno.
As we get started, we're still going to put some interactive activities into this quick boost. And I want to know what you think. So what do you think is the percent of teen deaths that are directly related to risk or risky behaviors? And Claudia is going to launch a quick Zoom poll. So if you can let me know what you think. It looks like we have almost 3/4 of you. We'll give it another few seconds. Okay, I think we can end the polling and share the results. So as you can see, 25% is what most of you thought, or 30%. And then we kind of had a range between the others. So let me share with you what the percentage is. It's actually 75%. So 3/4 of teen deaths are directly related to risk, which is why it's so important that we talk about prevention and figure out easier ways to make that happen within our programs, within our settings, our clinics. I also wanted to share a little bit of the RAPS top youth risks. We looked across a few different years. Obviously, 2020 is going to look a lot different, and we're just pulling those numbers right now. But what you can see here are what the top risks are across 30 states in a lot of different settings, from healthcare settings to schools to community-based organizations. Nearly 50,000 youth complete the RAPS annually. You can see that the top risk is not wearing a helmet when you're doing some type of activity, which could be riding a bike, it could be skateboarding, skiing, all of those different things. Then you can see what you would typically think about with adolescence, which is that sexual activity, unprotected sex, and mental health concerns are kind of rising to the top over those other categories of risk related to substance use. Additionally, we looked and drilled down into sexual health a little bit further. And 3/4 of youth have had sex in the last 3 months that are sexually active, and just over half have never had an HIV test. So we know there's some work to be done around screening, STI and HIV screening in youth. Along with that, we looked at condom use in those age groups, kind of that middle school age group, then early high school, and 18 and above. So you can see here as well that the younger the youth are, the more likely that they're not going to use condoms or another form of birth control. So all of these things are really important to know, not only kind of nationally with what the RAPS is showing, but also within your organization, so that you know where those subpopulations are of risk that you could provide some further intervention. So what can we do to deliver high quality risk prevention? It can feel super overwhelming. A lot of us think, like, where do I start? If I'm going to use a screening tool, what tool can I use or would be most beneficial? And then once that tool is identified, how do I put that into practice? So we're going to spend some time talking about that. So selecting a tool, a lot of times within organizations, you think like selecting the tool is really the first step and that's true, and sometimes the only step, but it's not the only step, because once you identify risks, how do you address those risks? And then what does your workflow and resources look like to incorporate that tool into practice? We know comprehensive risk screening tools have different ways that they are implemented, from interview to paper-based to technology-based. And as you go up, they are more effective in helping youth feel comfortable and confident in sharing, disclosing those risks with you. We also know that technology really helps connect professionals with those youth that are connected. Youth have now kind of grown up with technology, and they're very comfortable disclosing, using technology, and actually prefer that, and then to have a conversation with you. Just a little bit about the RAPS validated screening tool on technology. The RAPS is really focused in on identifying those highest risk behaviors that contribute to those premature deaths in youth. Like I was sharing that 3/4, 75% of youth population that has premature death related to risk. So we have different versions based on age, and those are very specific risks for those age groups based on the literature and CDC data. The RAPS is easily incorporated into practice. It's 21 questions, takes you 5 minutes or less in those 6 risk categories that contribute most to morbidity and mortality. And all of the questions have been validated to be an effective comprehensive tool, as well as a youth depression screening tool. So once you have a tool identified, or once you're asking those questions about risk, how do you provide that post-screening risk coaching? I want to do a really quick poll regarding motivational interviewing. So what is your experience with motivational interviewing? And Claudia will launch that poll for us. We'll give it just a few more seconds. What's your experience with motivational interviewing? Great. If we can end the poll and then show the results. So it looks like about 25%, or a quarter of you, have attended a training or two. So this will be a good refresher or reminder. We also have a good group of people that have minimal to no experience, and then using it routinely, about a third. Great, thank you. So that just helps give me an idea. So as professionals, we do feel a lot of pressure to know like how to help those youth when they disclose risks, that we have to have all the answers. And really, motivational interviewing takes that pressure off of us, because what we're doing is trying to establish the spirit of motivational interviewing, like how we look, the way we ask questions, how we respond to youth when they provide information to us. And then using very deliberate strategies that we all know. We know open-ended questions. We know focusing in on strengths is important with youth, a strength-based approach, and then using reflection. So I'm going to spend just a few minutes on each one of those. So to give you sort of an overview of the spirit of motivational interviewing, it's really about talking with and not at youth, because we're talking about it now and using it with our youth clients or patients. So if you look across the rows, I'll just read those out and think about how you feel when I'm giving you that information. So if you were a youth and I said to you, you need to tell me if you're having sex. Or I say, I know it can feel really uncomfortable talking about sex. Knowing a little more from you helps me decide the test you might need, or helps me decide, how I can help you more. So think about how those feel. The next one is, you're not vaping, right? Or there's been a lot of information coming out about vaping. What do you think? And then read through the next 2 rows, thinking about providing that information to youth, how they might be responding. when you tell them what to do or talk at them versus talk with them. So it's really about creating that spirit. And if you know motivational interviewing, you'll notice some of the strategies in the talking with side. So we're just going to delve into open-ended questions, affirmations, and reflections, just kind of an overview of what that looks like and how you might use that in practice. So open-ended questions are really those questions that are not easily answered with yes or no. It's the backbone of information gathering in motivational interviewing. And a lot of times when we're doing workshops, we all feel like we use open-ended questions a lot. But if you start to be aware, you'll notice that you use a lot of close-ended questions, just yes or no responses. So the first step would be being aware of how you're asking questions, and then thinking about those basic who, what, when, where, and how, using those more often to start questions that you're asking youth. Sometimes even those questions give you like a 1 or 2 word answer. So within motivational interviewing, there's something called fully open questions or fully open-ended questions and key questions. So fully open-ended questions start with these phrases. What do you think about? So you might say, what do you think about using condoms? Tell me about, you can use pretty much for anything that you might want to ask. Tell me about drinking. Tell me about vaping. How do you decide when to? I use that a lot when I was talking with youth in clinic. Like, how do you decide when to use condoms and when not to? Because if you work with youth in sexual health, a lot of them will say, oh, I use condoms sometimes. Well, how do you decide when to use them and when not? And then help me understand. Help me understand can be a really powerful starter if you use why a lot, because why can feel judgmental, even if you're not meaning it to be. So if you start with help me understand why, it kind of takes why off the first word and reduces some of that resistance. And then key questions are really about that planning piece. Like, what are you going to do next? So given everything that we talked about, given what you told me, what do you think you're going to do this weekend? What do you think you're going to do next time you're at a party and you're offered alcohol? Where would you like to go from here? What if you tried? And what would it take? The what would it take I really like, because then it's more of a hypothetical. Well, you might not be ready to change yet. What would it take for you to quit vaping? So it helps you start thinking through, even if they're not ready to commit, what would it take for them to take that first step? So these can be really powerful questions. So we're going to do a quick activity around this. So I want you to answer the following question in chat. And this is a question that you're asked all the time. How was your day? Anytime we get on calls, like, how are things going? How was your day? How do you typically answer that, or how would you answer? Just kind of type into chat some of your responses. So I have like good, fine, busy but good. Things are going pretty well. So you usually get maybe a 1-word answer, and especially from youth. You might get like a shoulder shrug, something like that. So now think about this next question. Tell me about your day. So if I said to you, we got on a call and I said, oh, tell me about your day, what kind of things would you share? Type into chat some of those things. If I said, tell me about your day, what you would share. And think about, what do youth share? So if you use this strategy, it's really one powerful takeaway, especially if you have teens at home, because we'll say like, oh, how was school? How was work? How was practice? And you'll get a 1 or 2 word answer. But if you say, tell me about, then you have time to think and share something that's really been going on. So I see I've made a TikTok, finished homework, helped my mom. So all of those things, you learn a lot more without having to grill with questions. So if you put that into like, tell me about using condoms, instead of, are you using condoms? You'll get a lot more information that'll help you move forward. The next strategy I want to just touch on is affirmations. So that really fosters self-esteem and self-worth. With youth, the higher their self-esteem internally, not just, sometimes we think they have a lot of feelings of self-worth because of how they're acting or what they're doing, but internally, they don't necessarily. So the more internal, like self-esteem, self-worth they have, the less likely that they'll engage in risk. And youth live up or down to our expectations. So the more we can encourage them with affirmations, the more they'll feel equipped to make safer decisions when they're in risky situations. And it really helps to empower our youth and families, because we're working with youth and their families as one unit most of the time. So affirmations are not I statements, they're you statements. So an example of this would be if we were working together and I said, I think you're doing a great job. Or I said, you're doing a great job. It's much more powerful when I take the I part off and I just say, you are doing a great job, or you're great at your job, you're a great nurse, you're a great provider, social worker, whatever. It sounds more powerful when it's a you are, you have, you feel, you believe statement. So some examples of that might be like, you have a plan for quitting vaping. That's an affirmation. They've thought through a plan. They have one. You're a great friend. You feel in control of your body. That's a strength. If you feel in control of your body, you're going to make safer decisions, or you believe in taking care of yourself. All of those affirmations will help build up that foundation for making safer decisions. So we're not going to create an affirmation in the chat. You're welcome to, as I talk a little bit about reflections. We did start about 2 minutes late, so I have about 3 more minutes before our 20 minutes is up. So if you want to try some affirmations, do that in the chat. If I've tried using condoms, it just never works out. So sometimes we jump to trying to solve that problem, but providing an affirmation first would be a very powerful step so that youth are engaged then in the conversation about trying to figure out how it will work. And an example that I could give you would be, you use condoms even when it's hard. That's an affirmation to this statement. So kind of think through how you might create affirmations with you have, you are, you feel, you believe for this. And then lastly, reflective listening sometimes is the most difficult to master, but it's definitely the most valuable skill. It's really an active process of listening to what that youth has to say, stating back what you heard rather than asking questions, which will lead them towards continuing the conversation. So you don't have to ask a question every time. And sometimes you would add an emphasis, an additional meaning, or a continuation of thought on reflections. So same thing, I've tried using condoms, it just never works out. A reflection to that might be, you're having sex and not using protection. Just as a statement, not with an inflection as a question at the end, and then they'll continue the conversation. Or you're not using protection and you don't want to get an STI. So we're making an assumption, probably pretty true for most youth, that they don't want to get an STI. So we're helping lead them towards some motivations for wanting to use condoms or being safer when they have sex. So if you want to learn more, we have MITEY Change, motivational interviewing training for empowering youth towards change workshops that are a combination of a self-paced online module and a live workshop piece. So we've been in person over the last 5 years. 2020, obviously we were virtual, but would love to kind of dig into these strategies with you more. If you're interested in finding out about that, the MITEY Change really supports your staff to support the whole team. So clinical staff, program staff, can then use those strategies when working with parents, working with youth, help them start incorporating some of the strategies, open-ended questions, affirmation reflections into the communication they have with each other. It's really such a great skill to have when communicating using motivational interviewing strategies. So definitely reach out if you want to learn more about that, and or look in your communities. You may have some motivational interviewing workshops happening more locally to you. If there are any questions, I'm definitely open to taking a couple of minutes to answer those. You can see the contact information here. If you want more information, you can definitely reach out to us outside of this boost, send us a message. And I can show you my contact information, and then info@pause4change if you have any other questions. So hopefully this was a great use of 20 minutes, no burnout, and that you've taken a few strategies away that you can start using with the youth that you're working with right now. And thank you so much for your time.